People with a learning disability are more likely to be diagnosed with a higher incidence of mental health problems and complex physical health problems. What this means is that they run a higher risk of developing epilepsy, heart problems, and severe mental health problems. For example, we know that people with Down syndrome are at a greater risk of developing heart defects. We know that they are also at greater risk of developing hypothyroidism, at greater risk of having sensory impairments and the early onset of dementia. We know that typically 26% of people with a learning disability are diagnosed with the additional diagnosis of epilepsy in comparison to just 1% of the general population. The type of epilepsy that we see is more complex and more difficult to manage for people with a learning disability. It takes a more complex, multidisciplinary team approach to caring for them. People with a learning disability are also at increased risk of having additional sensory impairments, such as impairments to their vision and their hearing. They can also be at risk of having chronic pain conditions, often related to skeletal problems, related to cerebral palsy and other conditions such as scoliosis. People with a learning disability are also likely to develop an earlier onset of diabetes and osteoporosis due to congenital problems and lifestyle influences. The instances of respiratory disease in the population of people with learning disabilities is also 3 times greater than in the general population. People with learning disabilities are also likely to be more likely diagnosed with dysphagia, which is a swallowing difficulty that can result in the additional development of pneumonia.